Problems and Solutions in Homelessness, a review of the Continuum of Care program. Introduction. Homelessness in the United States is an epidemic that pervades our society. The most recent statistics show that on any given night in the month of January 2014, 578,424 people were experiencing homelessness. The economic nature of our country means that many people struggle with such things as soaring rental costs that do not match wage potential for many, a lack of affordable housing, and a reduction in public assistance combined with more regulations and requirements to qualify. A disproportionate number of racial minorities experience homelessness compared to those that are white. When a person has experienced turbulent life circumstances, trauma, or mental health issues, their risk for homelessness is far greater. Solutions are in sight. The Continuum of Care program is one such platform administered by the United States Department of Housing and Urban Development that has been put in place to address homelessness. This program will be analyzed for effectiveness and how it fares when using the Family Impact Analysis tool, which measures quality based on 5 principles associated with being family-centered. The underlying problems of homelessness. Many of the issues that contribute to homelessness coexist in an individual and family's experience, which makes them much more at risk to suffering homelessness. When the root issues are better understood, that knowledge can be used to aid in finding more effective solutions to combating homelessness. The main issues that will be discussed include declines in public assistance, economic and market conditions, racial disparity in class, and traumatic experiences.
We will now start with one of the root causes of homelessness, lack of housing subsidies. Aid to Families with Dependent Children, AFDC, was a housing subsidy. It was the largest cash assistance program for low-income families with children in the United States. Under AFDC, individual states were given federal funds based on their own contribution to state welfare programs. But in August of 1996, AFDC was repealed by the Personal Responsibility and Work Opportunity Reconciliation Act of 1996. Temporary Assistance to Needy Families replaced the Aid to Families with Dependent Children program. It changed the way funds were distributed by providing states with a fixed amount of funding to help families in need. It required each state to maintain a certain level of spending under AFDC. This allowed states that didn't contribute much under AFDC to be locked into lower investments for funding under Temporary Assistance to Needy Families. The problems with the Temporary Assistance to Needy Families program, or TANF, were that in 2005, TANF helped only a third of the children that were helped by AFDC. In 2005, 70% of funding was used to help families in need. In 2011, about 29% of state and federal funding was used to help families. In 2012, funding was even further limited when Congress failed to fund TANF supplemental grants. Economic and market conditions. Economic and market conditions have a great impact on all of society. 1 in 5 households is using 50% of their income to meet the rising costs of housing. This means that a working family or household on a fixed income needs $17.73 an hour to afford a 2-bedroom unit in Washington County, Oregon. To meet the current demand of affordable housing, America needs 7.1 million more affordable housing units. Most people don't know that a quarter of the homeless citizens have jobs, but don't receive a high enough paycheck to pay rent or mortgage. Racial disparity. In 2010, 1 in 141 black family members stayed in a homeless shelter, a rate 7 times higher than for white families. Black people and families make up 12.1% of the U.S. family population, but represented 38.8% of sheltered people in families in 2010. Federal policies that reduce the stock of affordable housing through urban renewal projects displaced a disproportionate number of poor blacks living concentrated in cities to other substandard urban neighborhoods. Traumatic experiences. Approximately one-third of the total homeless population includes individuals with a serious, untreated mental illness. There can also be a connection between housing stability and intimate relationships. To escape a poor living situation such as domestic abuse or relationship issues including drug or alcohol abuse, a person may find homelessness as their only option. After considering the problems underlying homelessness, it is easy to see how people can be disadvantaged by broad economic circumstances and personal experiences that increase their risk of homelessness. A person can experience more than one of these problems at a time, which only compounds the issue and creates even more barriers to obtaining stable housing. The programs and policies available to address the solutions to these problems are currently inadequate to reduce and ultimately end the problem of homelessness in our country.
The solutions to homelessness. Temporary assistance for needy families, TANF. How can Congress make TANF work? Congress must make changes to their requirements. Families that need assistance are not just single-parent households. They may be two-parent families as well. Congress needs to provide education and training. This would allow parents better access to higher-paying jobs. Families that qualify for TANF should not have a limited time frame. Length of assistance needed should be decided on a case-by-case basis. Policies should be put in place to aid families balancing their lives between work and home. Policies must be made to ensure TANF can be expanded and continue to fund low-income families. American Recovery and Reinvestment Act. This policy created the Emergency Contingency Fund for state TANF programs. The emergency fund put $5 billion towards states that had an increase in caseloads. This policy provides resources to help support work and families during difficult economic times. This policy was created to help build upon successful welfare programs already in place. Homelessness prevention programs. Homelessness prevention programs help families resolve their crises, secure rental assistance, and access ongoing sources of support in the community. If a family is unable to stay in their home, the program can help the family find safe, reasonable, affordable, and adequate housing. These programs are designed to offer time-limited assistance to a large number of families. Permanent supportive housing has proven effective in reducing the return of homelessness. By working with shelters, moving clients into permanent housing, then implementing assistance programs to keep them in their housing, we could eliminate homelessness. Homelessness prevention programs continued. Early identification of households at heightened risk of experiencing homelessness will allow partnering agencies to intervene and either help them to stay in their current housing or to focus on finding new housing so the family can avoid a shelter. Systems such as schools, healthcare providers, and child welfare agencies can all function as early warning systems. The staff from these agencies can help provide referrals and help to make connections to homeless prevention assistance programs. The 10-Year Plan. This was a program implemented by Washington State with the goal that in 10 years they would be able to create houses and supportive services to help thousands of homeless people. A group of housing and service providers, businesses, county and city people, and other homeless advocates started the idea in March of 2005, with the plan fully launching in July of 2005. The program's ultimate goal was to build 9,500 housing units and to provide integrative services to the citizens. The program will also provide health care, job training, and other related resources for persons struggling with mental health. It will also strive to establish a system for newly released prisoners to assist them in gaining employment and becoming better citizens. The 10-Year Plan continued. Since the start of its conception, other organizations and businesses have joined in to help with the problem of homelessness in the 10-Year Plan. The Homeless Emergency Assistance and Rapid Transition to Housing, or HERTH Act, was signed and put into law in March of 2009. This is the largest source of funding for the 10-Year Plan. From a report at the end of 2011, there were 5,046 units built. At that rate, their goal of 9,500 will be reached and potentially exceeded by the end of the plan. As of 2014, more than 4,000 people are no longer homeless. Rapid rehousing. In 2009, the Homeless Emergency and Rapid Transition to Housing Act was passed in an effort to modernize the U.S. Department of Housing and Urban Development's homelessness assistance program. This changed its focus to how a homeless person goes about getting help. Rather than having the homeless prove themselves of readiness for a home, they focused on providing rapid rehousing. Rapid rehousing provides a permanent, independent home as the initial response to resolving situations of homelessness in conjunction with flexible supportive services as required by the service needs of those who are rehoused to prevent recurrent homelessness. Family Impact Analysis. The Continuum of Care Program. The Continuum of Care Program, or COC, is a grant program administered by the United States Department of Housing and Urban Development. Its intention is to help communities reduce the amount of people experiencing homelessness. COC funds housing initiatives and provides services for individuals and families who are currently or formerly experiencing homelessness. COC provides services to assist families to move into transition and permanent housing. COC works to promote community-wide commitment to end homelessness by encouraging the community to create programs that focus on the strengths of its own community. Continuum of Care continued. Families become eligible for COC funding when they have been identified by nonprofit organizations, state and local governments, or public housing authorities as being homeless or in danger of becoming homeless. The amount awarded to eligible applicants, agencies, or government is based on information provided by the applicant based on the needs, availability, and location. The Homeless Management Information System grant monies help finance activities that assess the level of homelessness in an area. Once individuals or families have been identified, funding is provided for emergency shelter through Supportive Services Only, SSO, funds, or for more permanent housing options through rapid rehousing and rental and leasing assistance. Funding also exists for families who are on the verge of becoming homeless. Continuum of Care continued. Rapid rehousing is a plan for permanent housing, but the assistance is not permanent. After a certain amount of time, the assistance will end and the family will hopefully be able to take over the payments. The Rapid Rehousing Program serves all homeless people regardless of their circumstances. The program is used differently in all communities. Leasing assistance can be provided for permanent or transitional housing. The property is not owned by the recipient or the sponsor involved. Eligibility requirements are that the recipient must abide by the rules of their lease. The recipients are liable for paying the rent even if the unit is unoccupied. With rental assistance, a landlord is involved, who rents out the space that you submit payments to monthly. The assistance can be tenant-based, project-based, or sponsor-based. The eligibility requirements are different for the type of project-based chosen. The Supportive Services Only SSO program component enables recipients and subrecipients of COC program funds to provide services to homeless individuals and families who do not live in housing that is managed by the recipient. Several types of services are eligible for the SSO program. Participants can use employment assistance and job training services, education services, legal services, life skills training, and housing search and counseling services. They can also utilize other services such as childcare, food assistance, and transportation services. There are several health services that are also a part of the SSO program: outpatient mental health services, outpatient health services, and outpatient substance abuse treatment services. These services are offered to permanent supportive housing and transitional housing residents during the entire time that they are residents, as well as former individuals can receive services for up to 6 months. Continuum of Care continued. COC program is dedicated to both collaborating with community members to address homelessness while also exploring the immediate and long-term needs of the homeless community. The COC program requires that agencies who receive grant money have a method in place to record data that highlights the success of those needed services, as well as indicating services that should be implemented. The Homeless Management Information System, HMIS, which is funded by COC, is a tool that provides data that is used by the U.S. Department of Housing and Urban Development planners and policymakers. The collected information is used to improve homeless policies as well as inform decisions that are made at the federal, state, and local levels. Principle A, family responsibility. How well does the policy, program, or practice help families build the capacity to fulfill their function and avoid taking over family responsibilities unless absolutely necessary? COC is a program that is dedicated to developing outreach services to help identify the needs of the homeless and those at risk of becoming homeless. COC promotes and supports individuals and families by collaborating with communities to explore and implement services they can utilize to draw them out of their homeless situation. COC program allows families to fulfill their functions by providing monetary support in a necessary way because otherwise they would be homeless. The program does not take over all of the family's responsibilities because it has limitations on funding and requires that a percentage of income be paid towards rent under rental and leasing assistance. Principle A continued. How well does the policy, program, or practice address root causes of financial insecurity such as high child support, debt, low literacy, low wages, and unemployment? COC provides funds for those who are experiencing homelessness or are at risk of becoming homelessness. COC programs also provide funds to local agencies that provide a range of services, which include job skills and educational programs to help put people back to work. COC does not, however, address the root economic cause of homelessness, which is that wages are not appropriate and proportionate to the cost of housing. If wages were truly in proportion to housing costs, programs like the COC would not be necessary. Principle B, family stability. How well does the policy, program, or practice help families avoid problems before they become serious crises or chronic situations that erode family structure and function? COC programs have a homeless prevention component. Designated programs within the COC can use COC funds to fund homelessness prevention and assistance for individuals and families at risk of homelessness. This can also help families avoid the problem of homelessness before it even becomes a serious issue. Services available can help families maintain their regular routines while they are going through a time of crisis. Through the permanent housing component of the COC program, formerly homeless individuals and families can live in community-based housing that encourages them to live as independently as possible. Principle B continued. How well does the policy, program, or practice help families maintain regular routines when undergoing stressful conditions or at times of transition? The goal of the Continuum of Care program is to help homeless individuals and families move into transitional and permanent housing and eventually achieve long-term stability quickly in order to minimize the trauma. COC program supports community-wide commitment to the goal of stomping out homelessness. COC programs provide funding so that nonprofit providers, states, and local governments are able to rapidly rehouse homeless individuals and families, and at the same time minimize the trauma experienced by these families and individuals as a result of being homeless. In order to minimize disruption and trauma, people can apply to an agency for COC funding as soon as they have received an eviction notice in order to avoid becoming homeless. The fact that the program is community-based means that housing will be provided within the same community if desired, which helps families maintain regular routines. Principle C, family relationships. How well does the policy, program, or practice take steps to prevent family abuse, violence, or neglect? COC provides funding to help relieve stress on a family that could lead to abuse, violence, or neglect by ensuring that they do not become homeless or that they are rapidly rehoused if they do become homeless. In addition, the SSO component of the program provides funding to intimate partner violence shelters to house people who wish to leave an unsafe home environment where violence has already ensued or been threatened. Principle D, family diversity. How well does the policy, program, or practice identify and respect the different attitudes, behaviors, and values of families from various stages of life, family structures, and cultural, economic, geographic, racial or ethnic, and religious backgrounds? Continuum of Care program addresses this issue of racial disparity directly by requiring compliance with the Fair Housing Act, which prohibits discrimination in housing on the basis of race and skin color. Although the FHA has resulted in the reduction of racial discrimination in housing, it still has its flaws. FHA has not been effective in eliminating more subtle acts of discrimination, such as zoning that does not allow affordable housing to be constructed in white neighborhoods. Principle E, family engagement. How well does the policy, program, or practice provide full information and a range of choices to families, recognizing that the length of intensity of services may vary according to the family's needs? The Continuum of Care program has several different programs, such as the Rapid Rehousing Program and Rental and Leasing Assistance. These different programs cater to the family's specific needs by varying the time of assistance from 3 to 24 months. Conclusion. The Continuum of Care program is a family-friendly policy that allows families to function normally by providing monetary support and educational programs, which in turn allows them to live as independently as possible. COC's strengths. It works with the individuals and families alongside the community to help them get out of homelessness that they may currently or previously experience. It provides opportunities to learn new job skills and continuing education in an effort to find a better paying job to support their families. COC has housing communities that allow the families to live as independently as possible. A family can apply for housing within their own community so that they can continue their regular routine. With homelessness being traumatic on the family, the program helps in getting families into homes quicker to reduce the impact of their situation. COC limitations. It doesn't get down to the cause of the problem. Wages are too low to provide for a family, but if wages were adjusted to reflect the living wages of each family, homelessness may be prevented in many cases. COC program is also beholden to time limit for families. In some cases, 3 to 24 months may not be enough time to get back on their feet. There may be situations that come up, job losses, illnesses, death in the family, that some families may not be able to recover from within the preset time limits. While it does comply with the Fair Housing Act, affordable housing isn't always allowed in white neighborhoods. To actually address the racial issues, the housing should be allowed in any area, making sure that housing is affordable to all.